I am really excited again to have an opportunity to talk more with Dolores Cimini, who, as I mentioned earlier, been part of both the cohorts 1 and 3 GLS grant projects with the University of Albany. And we're going to spend the next 10 minutes talking about a couple of different aspects of Dolores's experience with developing and revising crisis protocols. So Dolores, are you with us?
Yes.
Excellent. Okay, I'm going to get us started off with our first question, and that is whether you can tell us briefly about your campus and also a little bit about what your campus crisis protocols cover.
Sure. Our campus, the University of Albany, is one of the 4 university centers in the 64 campus State University of New York system. We have about 18,000 students, 13,000 of which are undergraduates. The rest are graduate students. And the way we approach suicide prevention and prevention in other areas is through a comprehensive program. So we look at the issue in terms of universal reach, and that is through for the whole campus community. Selective interventions for those students who may be at risk for suicide and other risk behaviors, and then indicated interventions, treatment and referral. And we have a whole gamut of different types of things that we do to comprise our comprehensive program across those areas. We have presidential support and leadership. We have a crisis response team and a student of concern committee. We have student engagement in the issue of suicide prevention through prevention programs and through a peer-driven and professionally supervised hotline. We have parent interventions. We do research on what we do and include a number of different interventions in that area. Our crisis protocol was developed in 1990 and has been revised several times since that time, and it really does follow almost to the letter the JED Foundation recommendations. We have not only suicide of students addressed in the protocol, but we also have other types of crises. For example, a student going to jail, a student who's disruptive in class. So a whole variety of different issues. And we list a definition of what the particular issue is, and then we talk about step by step what is done first, what's done second, what's third, and then more importantly, who does it.
Great. So it sounds like not only do you have a real comprehensive range of programming and initiatives that are happening on your campus, but when it comes to your protocols, those are similarly comprehensive and not only detail the specifics of different scenarios, but also clearly identify who's in which role and what responsibilities those people have, so that when it comes to actually needing to refer to the protocols, there aren't as many questions or gray areas as you might run into if those things hadn't actually been spelled out beforehand.
Correct. Yes, we have a variety of different representation in our crisis management group, and all the way from residential life to student affairs to student involvement in leadership, of course, the counseling center, health center, our interface center, vice president for student affairs, academic affairs. We also have student representatives from our Middle Earth Peer Assistance Program, hotline program, and our student ambulance service. So we really have a cross-section of representatives who have informed the development of our crisis protocol, but also then from each of those departments we pull first responders, so that not only do people have buy-in in the development of the protocol, but also in the response.
Okay, great. And I think that gives us a really good list of the people who have been involved, in implementing the protocols. And I guess I was wondering, I did want to ask you a bit about, hang on one second. There we go. Who was it that you brought to the table when you were looking to create these protocols? I know that you just listed a number of different groups. And so I'm wondering, sort of those people, where you started when you were thinking about who you wanted to be involved with developing these protocols, and sort of how that group took shape.
Sure. When we first developed our crisis protocol in 1990, we actually went and did research and looked at the protocols that existed from other schools, particularly Cornell University, which had a very comprehensive protocol at the time and continues to. And what we did is we looked at the key stakeholders that they engaged in their protocol, and we also, because we're comparable institutions in size, um, engage similar representatives. For example, our vice presidents for student affairs, academic affairs, and people from the counseling center, leadership from the counseling center, health center, interfaith center, judicial affairs, um, academic advising. Also very important to be at the table is our media office, because they're the ones to communicate with our campus and the broader community, and of course the university police as well were involved in the planning. So that's really our key team, and
Great.
and the team meets regularly to look at the protocol and revise it as needed.
And I know that when we were asking participants earlier who they thought would be important to have involved in developing and revising protocols, a number of the people who you just mentioned were on their list too. So it's always good to hear that people are more or less on the same page, although I do realize that things vary from campus to campus, and sometimes it makes more sense to be more inclusive or less inclusive, and so forth. So I'm wondering now, when you had this group assembled at the table to create the protocols, how did you decide what you wanted to include?
Well, again, what we looked at was the models that were out there, and we looked at what was applicable to our campus. We also looked at our own history of crises that we experienced and how we responded to them. For example, we, of course, had suicides occur, but not for a long time prior to the development of our protocol. We developed it as a proactive measure. We had also had a campus gunman um, around the time of, well, actually shortly after the development of the crisis protocol, and so that was a real time to use our protocol. And so what we included was the information that is most direct and most essential for people to know in order to respond seamlessly to a particular crisis. And that actually changed over the years. Originally, our crisis response protocol was a very long document, like 30 or 40 pages long. It was very,
Wow.
very detailed. And then we found it wasn't as useful as years went by, so we created a smaller version that went out to all faculty and staff. That was about a 16-page booklet. And now we've actually narrowed it down to a two-sided handout that we laminated. On one side is the emergency protocol, helping people determine what's urgent, what's emergent, in a variety of different crisis categories. And then on the back of the handout, there are warning signs for suicide, homicide, and other kinds of emergencies. And we like the idea of having the document laminated so that faculty and staff would be more likely to keep it on their desk. So we were able to narrow down a 40-page document, which we still have, and we refer to for those that need to look at that level of detail. But for everybody, we have a two-sided document that's laminated that we distribute, and it's also on the web.
Oh, perfect. And I think that we have that actually in our link section at the end. And that's an important lesson that you learned. I think it's very similar to the lessons that a lot of us in the field learn. When we create these longer, more comprehensive documents, and then we realize that they're not as practical as being able to provide something that's shorter and beyond that, something that's a little bit more quick and dirty with a two-sided, in your case, laminated reference document that people will be able to keep around and to use, more in the moment, and that they're more inclined to refer to it. So that's a really important important piece of information, I think, to have in terms of how you can actually get people to access the information that you've so carefully pulled together. And that leads me to my next question, which is, what are some of the lessons that you've learned during this process?
Well, the lessons that we learned include the following. First and foremost, it's really important to engage a broad level of representation from the get-go when one is planning a crisis protocol. And the most important reason for that is to get different perspectives, because different departments have different perspectives as to how things go. And there, of course, are formal and informal procedures on every campus, so we need to get everybody at the table to help understand what's formal, what's informal, what people expect from different departments, that kind of thing, and what really actually happens. So engaging those folks at the table for the broadest representation and also for buy-in. People really want to have a sense that they're valued in an important decision such as development of a crisis protocol. So engaging them. And also it's important to know that the crisis protocol is a living document. So as years go by, and as I mentioned in the prior question response, that we actually changed the length and the look of our crisis protocol to be more useful at different periods of time in our campus history. It's important to make language clear in the crisis protocol and to clearly specify who does what. Another important thing is when we talk about first responders, not to have only one first responder identified from every department. We want backup people because it's very, very draining to deal with suicide, not to mention one suicide, but also if, God forbid, we have a cluster suicide, which happened on our campus. And so to have backup people for every person, because people may need to rotate out, they may need to take breaks, they may need to take care, of course they need to take care of themselves. That's a critical part of a crisis protocol, to specify how we are going to take care of ourselves in addition to taking care of our campus communities.